This presentation is on pleiotropy and phenylketonuria. So pleiotropy is where a single gene disorder causes problems that affect multiple tissues and functions. As you can see, it's a single gene affecting multiple traits in the body. And then phenylketonuria, or PKU, is an autosomal recessive disease where the phenylalanine hydroxylase gene is mutated. This means that the phenylalanine in the body is all converted into phenylpyruvic acid instead of tyrosine, which is an essential amino acid that the body uses to produce dopamine, norepinephrine, epinephrine, and melanin, to name a few. The buildup of phenylpyruvate disrupts brain development and can lead to permanent intellectual disability, among other effects. So why is it significant to healthcare? PKU is significant to healthcare because it affects 1 in 10,000 to 15,000 newborns. Every newborn is tested at birth because PKU can be treated with diet and blood tests to monitor phenylpyruvic acid levels, and it's easy to treat to avoid heartbreaking effects, and people with PKU can go on to live normal and healthy lives with little to no side effects. So it's really important as healthcare workers for us to take care of them and avoid those sad things. How is it useful or detrimental to the health of a human? So pleiotropy, this mutation can be positive or negative to the health of a human. The positive effect that I liked the most was sickle cell anemia. It gives the people who have it a protection against malaria, but the negative effect of it is that you have sickle cell anemia, you're going to need blood transfusions and have oxygenation issues. And then another example is Marfan syndrome. It can help you be taller, you can reach stuff on your refrigerator, but it comes with heart problems and possible dislocation of the lens of the eye. You get hit in the chest, it can cause death. So, pros and cons. PKU. Patients can develop permanent intellectual disabilities without the diet control and the phenylalanine control. They can have seizures, delayed development, heart abnormalities, behavioral problems, and psychiatric disorders, such as aggression anxiety. And then they can also have lighter skin and hair than their siblings and eczema. I couldn't find any really positive effects to PKU, however. And then for medical advances, there are early blood tests on every baby. In the U.S., it's required because it's so easy to avoid those negative effects. And then once they test positive, they're going to have frequent blood tests that monitor phenylalanine levels. They'll have weekly blood tests until 1 year, biweekly to monthly, ages 1 to 12, and monthly in adolescents and adults who are stable and well controlled. They want to keep the phenylalanine levels at 2 to 6 milligrams per deciliter, and then they want a phenylalanine restricted diet. I have an example of some of the foods that they can and can't eat, and then they will have a low protein formula and food. And then the medications that they can take are sapropterin and pegvaliase, and they help decrease the phenylalanine blood levels. And then they're also going to want to monitor the tyrosine levels and supplement it when needed if it gets too low, because it's important to have. It's an essential amino acid. And then if a woman is pregnant and her phenylalanine levels should be maintained at 2 to 6 milligrams per deciliter before conception and through pregnancy to avoid miscarriage and poor effects on the fetus. And then sapropterin can be used to help lower the phenylalanine levels during pregnancy. And there are no contraindications in breastfeeding postpartum as long as the infant doesn't have PKU, because the infant is able to metabolize the slightly higher phenylalanine levels in the breast milk. But if they have PKU, then they'll have to go in the formula. And then here are my references. Thank you.